Mental health effects of COVID-19, influence of coping style and cognitive appraisal, conducted by Cassandra Burpo. Current research across the country examining the possible effects of COVID-19 on individuals, including essential employees, has shown the overall detrimental effects on an individual's depression, anxiety, and stress. Currently, the United States has 6 million confirmed cases of COVID-19 and has experienced over 200,000 deaths. As Lazarus and Folkman noted in their work, choice of coping strategy depends on how we appraise the situation. Coping strategies can involve thoughts, responses, as well as feelings to stress. The transactional stress model supports that the cognitive systems of a person is a key factor in managing stress. According to this model, stimuli are evaluated in two ways: primary appraisal and secondary appraisal. Also, according to this model, the way someone perceives the situation influences the level of stress experienced. Of the different appraisals, research has shown that challenge appraisal, meaning that an individual feels they have the skills and resources to address the stressor, tends to decrease stress, whereas threat appraisal overwhelms an individual's sense of coping and available resources to overcome the stressor. Research examining the mental health effects of COVID-19 are evolving. Those studies to date show that it can negatively impact mental health, particularly for those who are frontline workers. It is unknown whether the same impact is experienced by other essential workers outside of the healthcare field or those who are deemed non-essential. Furthermore, research has not examined the impact of coping style and cognitive appraisal in regards to COVID-19 as it affects to mental health. Therefore, the purpose of this study is to investigate the mental health impacts of COVID-19 relative to one's coping style and cognitive appraisals in those who are deemed essential and non-essential. In this study, essential workers were defined as someone that was considered necessary and essential to continue critical infrastructure operations. Mental health was defined as one's depression, anxiety, stress, and trauma. 3 hypotheses were proposed for this study. A total of 351 participants were recruited for this study through email, community websites, and social media. Voluntary consent was obtained by each participant. After participants completed all questions, they were debriefed, including providing them with a list of mental health resources. 5 different measures were used for this study, including a demographic questionnaire that was created, the brief COPE, which is the abbreviated version to the COPE instrument and was used to measure predominant coping style. The impact event scale is a revised 22-item, which is self-report that measures subjective distress caused by traumatic events. The stress appraisal measure was created to measure both primary and secondary appraisals of coping. And finally, the depression, anxiety, stress scale. This was used to measure core symptoms of depression, anxiety, and stress. The majority of participants were Caucasian female who worked full-time. 67% of the participants reported being deemed essential members, and 27% reported being classified as non-essential members. Of the essential members, 12% identified as healthcare workers, 34% mental health and social work, and 5% identified as food and retail employees. To test the first 2 proposed hypotheses, a one-way between-subject MANOVA was completed with the independent variables being whether someone is essential or non-essential. It was predicted that individuals who are essential would endure significantly higher mental health and levels of mental health issues, including anxiety, depression, and stress, than those who are non-essential. The partial findings suggest that essential members are reporting significantly higher depressive symptoms than non-essential members. There were no significant findings on hypothesis 2. To test hypothesis 3, a two-way between-subject MANOVA was conducted, with the independent variables being the type of coping and type of appraisal. Participants were grouped based on their preferred coping and appraisal style by taking the highest score on the brief COPE and the SAM. These findings show that individuals utilizing threat appraisal and avoidant coping are experiencing higher levels of depression and stress and overall traumatic symptomology. The results of this study support the current literature that is available stating that COVID-19 is resulting in increased depressive symptoms for essential members of the community relative to non-essential members. Essential workers outside of the healthcare industry are experiencing depression. Additionally, the coping mechanisms that an individual uses, as well as how they appraise the current pandemic, influences whether or not someone will experience mental health effects, meaning that members who engage in avoidant coping and who utilize threat appraisal are at a higher risk of mental health symptoms, including depression, stress, and anxiety. Lastly, future studies should continue to examine the overall and possible long-term effects of COVID-19 on all members, essential and non-essential, in order to provide accurate and effective treatment to all members of the community.